Thank you for choosing Axxess On Demand. We're the fastest growing home health technology company, helping improve care for more than 1.5 million patients and trusted by more than 7,000 healthcare organizations to grow their business. Axxess is a firm believer in continuing training, and we create content so you can learn and grow anywhere, anytime. Let's get started.
Hi, my name is Susanna Welch. I'm the Patient Engagement Research Coordinator here at Axxess. I'm also a certified patient experience professional from the Patient Experience Institute, and today I'll be giving a presentation on the Home Health CAHPS survey. Today the goal is for you to learn about the background of the Home Health CAHPS survey, the role of the HH CAHPS survey in our current healthcare environment, and how to utilize the HH CAHPS survey to enhance your organization's operations, and interspersed throughout we'll also touch on key points of the Axxess advantage. So I want to start off first by discussing a misconception that we've come across in our years administering CAHPS surveys, and that relates to two industry-relevant acronyms, CAHPS and CHAP. So the acronym CAHPS that we'll be discussing today stands for Consumer Assessment of Healthcare Providers and Systems. CAHPS is funded by the U.S. Agency for Healthcare Research and Quality, or the AHRQ, and is designed to measure the patient experience while receiving home health care from Medicare-certified home health agencies. Conversely, the acronym CHAP stands for Community Health Accreditation Partner, which is an independent, nonprofit accrediting body for community-based healthcare organizations, and it helps organizations determine how well they're performing around key indices. CHAP accredits 9 programs and services, and so here you can see the difference in the distinction between CHAP and CAHPS. And again, today we're focusing on CAHPS, the Home Health CAHPS survey. So to the benefit of transparency and full disclosure, Axxess is a CMS-approved home health CAHPS survey vendor, and also the only home health software vendor that's actually been approved by CMS to perform the CAHPS survey. This enables us to perform automatic monthly patient downloads from Axxess Agency Core software, which is the name of our electronic health record software, and administer the CAHPS survey automatically without clients having to worry about uploading patient files each month. So we believe that really sets us apart in the industry and that clients are actually getting a level of innovation that's unparalleled throughout the CAHPS survey industry as well as the healthcare industry. Delving further now into the Home Health CAHPS survey, I want to begin by outlining the meaning of the acronyms HH CAHPS and then move further to the survey's purpose, measures, and requirements around HH CAHPS. So the acronym HH CAHPS stands for Home Health Consumer Assessment of Healthcare Providers and Systems. As we touched on briefly previously, the acronym CAHPS is a registered trademark of the AHRQ, and again, that's Agency for Healthcare Research and Quality. The acronym CAHPS originally stood for Consumer Assessment of Health Plan Study, but as the products have evolved beyond just health plans, the name has evolved as well to capture the full range of surveys. CAHPS surveys ask consumers and patients to report on and evaluate their healthcare experiences with healthcare providers and the systems they encounter throughout healthcare. They cover topics that are important to consumers and focus on aspects of quality that can be best assessed or most effectively assessed by consumers, including things like ease of access to healthcare services, communication skills of providers in healthcare, and things of that nature. Users of CAHPS survey results include patients and consumers, quality monitors and regulators, provider organizations, health plans, community collaboratives, and public and private purchasers of healthcare. These individuals and organizations use the CAHPS survey results to make informed decisions and improve the quality of healthcare services. So in addition to the Home Health CAHPS survey, the list of healthcare organizations utilizing CAHPS survey instruments continues to grow. Examples of other survey instruments in the CAHPS survey family include Hospital CAHPS, which is abbreviated HCAHPS rather than HH CAHPS for home health. In-center hemodialysis CAHPS is another example, which is abbreviated ICH CAHPS, and that is for dialysis patients. And then CAHPS Hospice, just to name a few of the other CAHPS types. Axxess is also an approved vendor for a number of CAHPS survey types in addition to Home Health CAHPS, including the few that I just mentioned previously. So what exactly is the Home Health CAHPS survey? The survey measures the clinical experiences of patients receiving home health care from Medicare-certified and in some cases non-certified home health agencies. The HH CAHPS survey evaluates patients' experiences with their healthcare organizations overall, as well as their experiences with individual providers during their healthcare. This includes nurses, physical therapists, occupational and speech therapists, and home health aides. The survey tends to be specific to Medicare and Medicaid patients, and that includes patients enrolled in Medicare fee-for-service plans, Advantage plans, or managed care health plans. The survey typically includes 32 to 34 questions and takes about 12 minutes to complete, and that approximation is according to the Office of Management and Budget. And it is possible for organizations to have supplemental questions added to the survey, which would then further lengthen the survey. When we think about the purpose of the HH CAHPS survey, it's critical that organizations really understand what the survey is trying to evaluate. So the HH CAHPS survey evaluates the level of care provided by home health agencies, the frequency that best practices are utilized in patient care as well, improvements in key areas of patient care, and the overall experiences of patients receiving home health care. HH CAHPS survey results are reported publicly, which furnishes a level of transparency that allows stakeholders and consumers to access and review agencies' performance on the Home Health CAHPS survey measures by accessing the CMS website Home Health Compare, which we'll discuss a little bit later on in this presentation. Next, we'll be moving on to the responsibilities of home health agencies with regard to CAHPS and survey participation requirements. Medicare certified home health agencies that have serviced a total of 60 or more unduplicated survey-eligible patients during the 12-month annual update period, which runs from April 1 of the previous year to March 31 of the current year, must participate in HH CAHPS. As shown in this example scenario, an agency that served 60 or more patients between April 1, 2017 and March 31, 2018 is required to participate in HH CAHPS beginning 2018 and onward. There are only two scenarios under which a Medicare certified HHA can be exempted from participation in the survey if they elect to. Those two scenarios are, number one, if an agency received Medicare certification from CMS after the cutoff date for a given APU period, then the HHA is considered too new to participate in the upcoming APU and is therefore exempted. Moving to the second and final situation where exemption may be possible, if the HHA served 59 or fewer survey-eligible patients during the 12-month reference period that the APU covers, the agency can request an exemption if they choose to, which must be submitted by the agency on the Home Health CAHPS survey website and by the CMS required deadline, which typically falls between January and March of the current year. In discussing these two possible exemption scenarios, you'll notice that I've emphasized agencies eligible for exemption can elect to request one. However, many agencies choose to begin participating in HH CAHPS even before it becomes mandated for them. So let's talk a little bit about why an agency would elect to do that. Something we always make a point to discuss anytime a client is considering submitting an exemption request is the competitive advantages of participating in HH CAHPS as early as is possible, and why the competitive nature of the industry and the growing focus on quality performance can have long-term lasting effects on an agency if not considered and conceptualized appropriately. So, all that to say, agencies that understand the value of the HH CAHPS survey often elect to sign with an approved vendor and participate in the survey well before it's actually required of them. So given that the CAHPS survey data is reported publicly and benchmarked nationally, it is critical that agencies understand that competitors in the industry are participating in HH CAHPS and gaining visibility to consumers and stakeholders and obtaining insights into their patients' experiences, which is most important when you're trying to provide patient-centered care. So ultimately, HH CAHPS is not just an opportunity to achieve a constructive industry reputation, but a valuable opportunity to identify areas of improvement and really center your healthcare services around the patient. We'll continue talking about leveraging growth and success in the industry through the survey, but let's transition a bit to discussing which patients are eligible to participate. Patient eligibility for the survey is determined by several attributes. Patients must be 18 years or older, covered by Medicare or Medicaid plans, including fee-for-service, Advantage, and managed care health plans. And they must have had a minimum of 2 home health visits from a skilled provider during the look-back period. We'll talk a bit more about what that means later on if you're not aware. So a question you may be wondering is, am I exempt? So we've just outlined the CMS requirements for determining whether or not your agency must participate in HH CAHPS. To summarize, if you've seen 60 or more unduplicated patients that are survey eligible, then you must participate beginning April 1st of the current year. If you fail to participate in the HH CAHPS survey, CMS will begin deducting 2% of your market basket rate starting the next annual payment update year as a penalty for non-participation. So in addition to the focus on using HH CAHPS to really leverage superior performance, it is also important to understand that it is a compliance requirement and that there will be a financial penalty for non-participation by CMS. Once you've decided to move forward as an organization, you must select an approved CAHPS survey vendor to administer your agency's surveys. CMS approves CAHPS vendors based on meeting the following parameters. So CAHPS vendors must demonstrate that they've conducted surveys of individuals as an organization for a minimum of 2 years, have a statistical sampling process in place, possess all required facilities and systems to implement the survey, and possess the ability to perform quality assurance. Some home health agencies are accustomed to administering their own internal patient experience surveys. However, data that's submitted to the CMS Home Health CAHPS Clearinghouse must be administered and submitted by a CMS-approved CAHPS vendor to ensure compliance. Once an organization has signed up with an approved vendor, on a monthly basis, the organization must submit a list of patients that they've serviced within the month to the vendor. The survey vendor then uses the patient information to determine a sample, contact the patients for surveying, and submit the data to CMS before CMS finally publishes it. For a number of organizations, once they sign up for CAHPS services and submit their monthly files, they simply wait to see their patient survey feedback once it's published on the CMS website. And the rest of the surveying process, clients are kind of left in the dark on how they're performing. One of the things we've sought to do at Axxess is to really increase the level of transparency for our clients throughout the survey process. So once an agency signs up, the monthly information files are pulled from our software automatically, so the agency no longer has to run the report, worry with formatting issues or transmitting it, and late penalties are eradicated entirely. So once we do that, the patients are sampled, surveyed, and the survey responses are uploaded to CMS. Throughout the process, though, clients have the ongoing ability to log in to their Axxess CAHPS portal and track where we're at in the survey administration process from start to finish, and of course review the results before they're published to the official CMS website and see what their patients are saying in terms of HH CAHPS survey feedback. Moving back for a little bit to patient eligibility and describing which patients can be sampled and selected for the survey. So the patient's payer must be Medicare or Medicaid, and again, to reiterate, that includes fee-for-service, Advantage, and managed care health plans. The patient must be at least 18 years of age by the end of the sample month. He or she must have had at least one home health visit for skilled nursing care, physical therapy, occupational, or speech therapy within the sample month, and must have had at least 2 home health visits by a skilled home health provider within the look-back period. So the look-back period includes the sample month and the month immediately preceding the sample month. The patient must not be deceased, must not be receiving hospice care, and must not be receiving routine maternity care during the sample month. Next, we'll review methods by which the survey is conducted. CMS has approved 3 methods of administering the survey. The first is mail-only mode, which produces an average response rate of 28.2%. Telephone-only mode, which yields an average response rate of 26.9%. And mixed mode, which combines a mail survey attempt followed by telephone attempts for non-respondents, and produces an average response rate of 35.3%. These averages were provided by CMS based on response rates received during data collection from quarter 2, 2016 to quarter 1, 2017, which is the 2018 annual update period. At Axxess, we administer surveys using all 3 survey administration methods. So depending on each client's unique patient population and specific needs, we determine a survey administration mode to best foster our client's success. We found that organizations with a truly patient-centered culture that's been built around offering excellence in patient experience typically yield much higher response rates across survey administration methods. So what questions are actually included on the HH CAHPS survey? The 32 questions are grouped into the following categories when reporting publicly. There are 3 composite measures. Those are care of patients, communications between providers and patients, and specific care issues. And there are 2 global ratings, and those are overall rating of home health care and willingness to recommend the agency. So here you can see each composite measure, each global rating, the questions that comprise those measures, and the text that's displayed on the Home Health Compare website. So whenever your scores are calculated, all your scores on each question comprise the composite measure category, and the text on the Home Health Compare website is displayed as shown here. So the text displayed on Home Health Compare for care of patients says how often the home health team gives care in a professional way. The communications between providers and patients domain is displayed with the following text. How well did the home health team communicate with patients? The specific care issues domain is displayed as did the home health team discuss medicines, pain, and home safety with patients? The overall rating global measure is displayed as how do patients rate the overall care from the home health agency? And the last global rating, patient willingness to recommend the agency, is displayed as would patients recommend the home health agency to friends and family. We'll first touch base on the care of patients composite measure and the questions included in that category. So the care of patients composite measures patients' reporting of their home health team giving them care in a professional manner. So the questions included in the care of patients composite measure all circulate around how often the home health team gave care in a professional way from the patient's perspective. So you can see there are 4 questions included in this category involving how often the providers seem to be informed about care and treatment, how often the providers treated patients as gently as possible, how often patients were treated with courtesy and respect by home health providers, and whether or not there were any problems that the patient had throughout care that he or she received from the agency. Next, we'll move on to the composite measure communications between providers and patients and the questions comprised in that category. So the communications between providers and patients questions all circulate around how frequently the home health team communicated well with patients from the patient perspective. So these questions include categories around how frequently the agency informed patients about the care and services that would be provided, how often providers kept patients informed about when they would arrive at the home, frequency that providers explained things in a way that was easy to understand, listened carefully to the patient, provided help or advice when requested, and how timely the office was in providing the advice as requested. Moving on to the third composite measure, specific care issues. All the questions in this specific care issues composite circulate around how frequently the home health team discussed medicines, pain, and home safety with patients. So these questions include topics related to whether or not someone from the agency discussed home safety and setting up the home for the patient to move around safely. Other items, did the agency talk with you about all the prescription medicines you were taking? Did providers ask to see medicines that were being taken by the patient? Did they discuss pain, the purpose for any new or changed prescription medicines, when to take medicines, and the important side effects of these medicines? And also note that each question, when the survey is administered, it's administered exactly verbatim as what you're seeing here. I'm simply just hitting high-level points so that you can understand really what the composite is attempting to evaluate. Moving on to the global rating questions, the first question is the overall rating of care. And this question reads, we want to know your rating of your care from this agency's home health providers using any number from 0 to 10, where 0 is the worst home health care possible and 10 is the best home health care possible. What number would you use to rate your care from this agency's home health providers? So this question, as an organization, an agency providing care, you want this question to always be 9 or 10. When CMS is publicly reporting this question, a 9 or a 10 is reflected positively and a 0 through 8 is reflected negatively. So if you have 2 total responses to question 20, and this is just an example, and one patient says 8 and one patient says 9, you get a 50% scoring because only one of the patients fell into the top box score of 9 or 10. The next and final global rating question is patients' willingness to recommend the home health agency to family or friends. And that reads exactly as, would you recommend this agency to your family or friends if they needed home health care? And the response options for the patient to select include definitely no, probably yes, or definitely yes. And again, when reported publicly by CMS, the scoring is based around the number of patients that selected definitely yes. So definitely yes is reflected positively. Definitely no through probably yes are all reflected as negative. So again, if you have two patients who have responded to this question, one selects definitely yes and one selects probably yes, you have a 50% scoring on this question because only 1 out of 2 patients selected the top box answer, definitely yes. Once the survey has been administered and data collection has concluded, the survey data must be submitted to CMS on a quarterly basis. For example, Quarter 1 2018, which consists of January, February, and March 2018, must be submitted to CMS by July 19, 2018. And subsequent quarters have submission deadlines following the same pattern. Once CMS receives the survey data, they perform case mix adjustment and publish the results to the Home Health Compare website. Thus far, we've discussed the roles of survey vendors, CMS, and home health agencies throughout the HH CAHPS survey processes. We're going to transition now to discussing ways the survey data impacts you as an organization directly, targeting specifically impacts beyond those related to compliance. Included in these topics, we'll review public reporting on Home Health Compare further, home health value-based purchasing, patient survey star ratings, and we'll conclude by outlining some of the key benefits of the HH CAHPS survey and ensuring optimal performance on the survey. We've mentioned several times that the results of the HH CAHPS survey are published on the CMS website Home Health Compare. A couple of background items on Home Health Compare. It was created by CMS in 2003 to provide information about the quality of care provided by Medicare certified home health agencies across the nation. And this information includes agency demographics, services provided, quality measures, and patient survey results reporting, which began actually in 2012. CMS established the Home Health Compare website on Medicare.gov as a key tool for consumers to utilize when choosing a home health care provider. So think of it kind of as a Yelp for home health care agencies. It's designed to be an easy-to-access, convenient source of authoritative information on provider quality. You can locate the Home Health Compare website at medicare.gov/homehealthcompare. So the website allows you to search for an agency by entering a zip code, city or state, or entering an agency's partial or full name. After selecting search on the screen, a list of home health agencies will appear based on whatever you've entered in the search feature. Basic information is provided for each agency, including its name, what kind of services are provided through the agency, and once you select a home health agency, you can view additional detailed information, including when the agency began operations and repeated information and details on services offered by the agency. You'll also notice that selecting Add to Compare allows you to select multiple agencies, up to 3 at a time, and compare them side by side. Selecting Compare Now will allow you to see more detailed data for each selected agency listed side by side again, and selecting the Patient Survey Results tab allows you to see how well the agencies have scored on a number of composite measures based on the HH CAHPS survey. If an agency has not participated in HH CAHPS or has not submitted data appropriately, then the organization will not have any data listed on the screen to compare to competitor agencies when consumers or stakeholders are reviewing this information. As an organization, if you do not have any HH CAHPS survey data and you're being compared to competitor organizations that do have data, it becomes far less likely that consumers will select your organization over others to utilize for home health care services, and then equally improbable that stakeholders will select your organization when seeking partnerships in the industry. So as a leader of your organization, it really boils down to ensuring a thorough understanding of insights behind the CAHPS survey. Leaders and administrators specifically should conceptualize HH CAHPS with a more global, high-level outlook and understand how HH CAHPS can leverage lasting success in the industry and in turn lead their respective organizations to understand these items as well, circulating around patient satisfaction as a deeply competitive advantage. So a few influential insights behind the survey include return on investment, understanding where you need to improve. So I'm going to talk about those a little bit here. The return on investment on your marketing spent for HH CAHPS repays itself multiple times over. Being able to build your organization around patient experience excellence and being superior in patient-centered service is invaluable to an agency. Satisfied patients will not only return to your agency if services are needed again in the future, but will refer friends and family to your organization, as well as inform their providers of exceptional services from your agency. So if physicians or other healthcare providers understand that your organization is providing excellent services, your referrals are going to proliferate and result ultimately in increased revenue for your agency. Further, moving beyond just compliance measures ensures that your organization is truly focused around providing the best possible care to patients, which means you begin to look at the best practices and your services will continuously improve, aligning you with the overall push toward quality improvement in healthcare. As supported by the Home Health value-based purchasing model as well, the Department of Health and Human Services is really cracking down on efforts to build a healthcare system that delivers quality care and spends healthcare money more wisely, resulting in improved care for patients and more cohesive communities in the healthcare industry as well. And home health star ratings, of course, further support that push toward quality. So let's review some of the key benefits of the HH CAHPS survey. The ability to improve patient outcomes by focusing your organization on patient care means that you will truly engage your patients, understand their experiences with your agency, and thus gather constructive insights into which areas need improvement. Further, it's understandable why the most successful agencies are those that utilize CAHPS data to gain a competitive advantage. Benchmarking agencies' performance against peers allows organizations to truly become superior and elite throughout the industry, and particularly utilizing a standardized measure ensures that that information is valid. Further, as we've touched on continuously, the real-time patient feedback can be utilized to truly ensure that patient-centric care is being provided, and that really should be the ultimate goal at all agencies. So now I'm going to move on to why we believe Axxess is the most competitive and most innovative solution in the industry. Seamless integration with the Axxess platform allows for automatic monthly downloads, prevents late file submissions, and ensures your compliance. Late file submissions are no longer an issue since it is automatic, and so agencies won't be pushed out of compliance for that reason, and file submission errors actually comprise the largest reason that agencies are found out of compliance and penalized. The HH CAHPS portal allows a transparent view of the entire survey process from start to finish. The intuitive interface and functionality allows a lot of user-friendliness for agencies to log in and access easily and interpret the reports and navigate the features very easily. Patient survey reports are available in real time. As soon as the patient completes the survey, it is uploaded to our server and produced in your HH CAHPS portal. Market insights reports are also offered in the CAHPS portal, offering a competitive advantage of how agencies are performing in your area and hospital readmissions in your area so that you can make informed decisions about partnerships in the industry. And finally, a library of education and resources is available on demand in the Axxess CAHPS portal and the Axxess Help Center. Finally, we believe that the cost is also one of the most competitive features with a flexible tiered pricing structure to really accommodate your agency's needs. Axxess provides intuitive tools which take organizations beyond compliance through knowledge-based insights and ultimately positions them for continued growth and lasting success in our dynamic healthcare industry. For additional questions, please visit our support ticketing center to directly engage with our Axxess customer support staff and request any help that's needed. You can access the support ticketing center under the Help tab on the top right of Agency Core as shown in the screenshot on the right side of the screen, or contact us directly by emailing caps@axxess.com or calling 1-877-480-9140.
Thank you for joining our on-demand training today and for choosing Axxess, a provider of innovative, cloud-based software, services, and solutions to help home health organizations improve patient care and grow their business. Axxess is the only healthcare technology company approved to award continuing education credits by the American Nurses Credentialing Center and is also the most recommended home health software on Software Advice. You can watch more on-demand training videos through our software or at axxess.com, where you can also find tutorials, blogs, white papers, and answers to frequently asked questions. Thanks again for choosing Axxess.